Pathway to Equity started 3 years ago, initially looking at non-attendance in young people with long-term conditions. But it has evolved over the last 3 years, going beyond hospital setting to a more community setting. Over the last 2 years, we discovered that what gets in the way of young people coming to hospital is not their health conditions, it's more the cause of them being unwell in the first place, including poverty, including living far away from hospital, not being able to afford a bus fare, or not being able to afford having extra time off schools and education that can have an impact on their progression. We started with a simple problem, NHS-based problem, clinic non-attendance. We used a system thinking approach to go through the different cultural and structural barrier that get in the way of young people accessing health. We discovered that the same structural and cultural barrier that get in the way of good health outcomes impact on their life in general, including access, equitable access to education and career progressions. Together with young people, we developed and we tested different work streams in the hospitals as well as outside the hospitals. And what we really aspire and we want to achieve more is to keep that connection going, because healthcare and education setting are actually struggling with the same problems. What we want to develop is a business case to make a case for the trust to develop the role of outpatient care coordinator. What we've shown through this experience with the peer support coordinator is having more personalized approach, especially with the high-risk patients who are struggling most, can help to build the trust, can help to meet the need of young people, and can help also to create value for both the young person as well as the trust. We can create cost saving that will help us to meet the need of our patient, but at the same time reduce our waiting time. Through this project, we improved our attendance rate by 13%. We reduced our non-attendance rate from 15 to 5%. So there is a chance that we can develop this further across all outpatient settings. Making a case for it took a lot of time and effort, but it's equally quite inspiring, because when people hear you and reflect and engage with it, it's very rewarding. And so far we had lots of engagement from public health. We had engagement also from the schools and teachers, as well as our trusts. So I'm hoping that the Pathway to Equity will be an example of project that can create meaningful connections between different settings that are actually overall serving our community. The deepest learning for me as a clinician is it's not about health and care. It's more about human connection. It's about humanity. It's about connecting with the community we serve, being curious and learn about it. And it's also about mobilizing and organizing. I think my biggest hope is keep the upstream and downstream world more connected and seeing our patients as a whole person rather than just as a disease, and moving from a reactive role of prescribing to a more proactive role, investing in prevention, because investing in prevention is a lot cheaper than actually investing in prescribing. I'm most proud of our team. We have a fantastic team, and I'm seeing a group of young people who are growing through this project, who are achieving their aspirations. That's one of the best moments throughout this project is the power of young people.